Hello, my name is Osvaldo Alvarez and I have here a volunteer. I'm a student for South University and we're about to perform the head-to-toe assessment. The volunteer was previously instructed to empty his bladder and we got a consent from him to do this assessment. First of all, I'm going to do the assessment of the upper body, in which I'm going to be physically observing for any abnormalities of the hair distribution and the shape of the head, and trying to find out if there is any scars in the skins or any areas where hair is missing, the hair distribution and the lines of the hair. Checking for abnormalities in the ear lobes, checking to see if there is any kind of asymmetry or symmetry in the ears, which they both appear to be symmetry in with a normal pink color and the warm to touch. There is no abnormal glands in the behind the ears or in the submandibular lines. Also, there is no any abnormal lobes in the cervical area, and I'm gonna make him move his head to both sides and compare if there is strength enough. Move your head, Armando, to your right. Move it to your left. Move it upward and downward. Do you have any pain, or do you feel any uncomfortable? No. Now I'm going to check the oculomotor reflex and the contralateral oculomotor reflex by pointing the light towards his eyes and checking his pupils. Alright, and now I'm going to evaluate the facial movements and expressions and lines. First, I'm going to evaluate the symmetry of the eyes, which are both at the same level, meaning that they are both symmetrical, and the hair distribution in the eyebrows and the eyelashes are within the normal limits. There is good distribution of hair in the eyebrows and eyelashes. And now I'm going to make him open and close his mouth to check his temporomandibular joints, which is okay. Do you feel any pain when you open? No. And in the face skin, there is no signs or symptoms of any disease or any scars. There is no tumors. The sinuses are not inflamed, and they are not tender either. And both nostrils are patent. I'm going to ask him to close one of his nostrils and inhale. It sounds patent. Do it with the other one. It also sounds patent. Now I'm going to observe for the hair distribution in his nostrils, which are good. Thank you much. I'm going also to check his oral mucosa and the pharynx mucosa to look for abnormalities. Open your mouth. I see that the teeth distribution are complete. I'm checking for dental caries and the oral mucosa. Stay your tongue out. And I'm also looking for the distribution of the gustative papules and the back of the pharynx, the back of the mouth. Now I'm going to examine and assess the thorax and the backs, looking for asymmetry and abnormal lumps or masses and abnormal movements at the time he inhales or exhales. I'm going to first of all look for symmetry of all the clavicle bones and the nipples and the hair distribution, which all seems to be okay. Now I'm going to palpate looking for abnormal masses and abnormal bumps in the, which is all within normal limits. There is no abnormal deformities of the bone or any abnormal masses. Now I'm going to palpate his chest expansion to see if it's normal. Inhale, exhale, inhale. Okay, now I'm going to ask Armando to turn around to physically assess the thorax, which both seems to be in symmetrical shape and with normal birth marks. And with the palpation, I'm going to make him inhale, exhale, inhale, exhale, which both expand perfectly. Okay, now I'm going to percuss to see if there is any abnormal sounds. They are both dull and normal. And bilateral equal. Now I'm going to turn him around to percuss the thorax in the front. I'm assessing for the cardiac dullness and for the hepatic dullness. The other aspect in the palpation phase is to assess for the vocal vibration, in which part I'm going to make him place my palm hands one at a time in his dorsal and make him pronounce the word 99.
99.
Say it again.
99. 99. 99.
Turn around, please.
99. 99. 99.
Now I'm going to proceed to do the palpation of the abdomen, in which side I'm going to start in the right lower quadrant with a lighter palpation, trying to find any abnormal masses or abnormal pain. Do you feel any pain?
No, I don't.
And since everything was normal, I'm going to do a deeper examination now, a deeper palpation to find any other abnormal or pains, which I can't find any abnormal masses or lumps. Do you feel any pain? Next, I'm going to proceed with the percussion of the abdomen, looking for any dullness or hyperresonances of the vital organs. In which I'm finding normal resonances. Now I'm going to evaluate both upper and lower extremities, in which I'm going to physically observe for any kind of inflammation in the joints, any hair distribution deformities, or any kind of abnormalities that can be found in the skin or the visible parts. Which in this case there are no deformities in the joints. And now I'm going to be assessing for the other lower extremity. They both look okay. Now I'm going to be assessing for the strength of both the lower and the upper extremities. Armando, could you please close your hand as hard as you can? Okay, thank you. Now I want you to extend your hands to your lower end. Don't put them down. Thank you. Now just do the opposite. Thank you. Now can you stand both of your feet? Okay. Can you stand them open? Oh, close. Thank you. evaluating all this skeletal muscular system, I'm going to go ahead and assess the spinal column for any kind of deviations or abnormalities. Armando, I'm going to ask you to bend over for me, please, and you can notice that there is no deviations or abnormal findings. Now we are going to assess for three things. We are going to assess for sensory, we are going to assess for locomotion, motor, and we're going to also assess for proprioception of the patient. Can you please stand up, Armando? I want you to close your eyes and then you let me know when I touch you.
Okay.
All right?
Okay. You touch. You touch. You touch. You touch. You touch. You touch. You touch.
Okay. Now, Armando, I want you to do something for us. I want you to close your eyes and extend both of your hands. Thank you very much. Now I want you to, with your right hand, right index, touch your nose. With your left index, touch your nose. Now I want you to put both of your indexes together. Thank you very much. Now I also want you to close both of your eyes closely together. Thank you. Open them back. Now I want you to push with your tongue to your cheek. Thank you. Now push with your other. To assess the patient neurologically, I'm going to be assessing the 12 cranial nerves. The first one, in which I have some kind of odor in this tissue that I have in my hand. I'm going to present it to him and he will tell me what he smells in this tissue that I have here. Okay, Armando, what do you smell in there?
It's a cold.
I'm going to assess cranial nerve number 2, which for what I'm going to ask Armando to cover one of his eyes and tell me the amount of fingers that I have in my hands. Armando, how many fingers do I have in my hands? 2. Okay, cover your other eye. How many fingers do I have in my hands? 2. We are going to assess cranial nerves number 3, number 4, and number 6, which are the oculomotor cranial nerves. I'm going to ask Armando to follow my finger. Now we're going to assess cranial nerve number 5, in which I'm going to use a sharp and a dull object so that he can tell me with his closed eyes which of the both of them am I doing. Close your eyes, Armando, and tell me if you feel a sharp or a dull touch.
Dull. Sharp. Dull. Dull. Sharp.
Following, we are going to assess cranial nerve number 7, which is the facial nerve, in which I'm going to ask Armando to close and open your eyes. Try to smile. Now I'm going to assess cranial nerve number 8, in which I'm going to be assessing for his hearing sensory perceptions. I don't have a turning fork. If I had a turning fork, I would be just dingling the turning fork and I will place it on top of his head, which will be the Weber test. And I will ask him, where does he hear it louder? And do you hear it louder anywhere?
No, similar.
The normal will be bilateral equal. And then I'm going to do the right eye test, in which I'm going to place the turning fork in the mastoid bone. And once he stops hearing it, he will let me know. When you stop hearing, let me know.
Okay, now I stop.
You stop, then I'm going to place it into the air and he will let me know when he stops hearing it.
Now I stop.
Now you stop hearing. Normal would be the air conduction would be 2 eyes as much as the bone conduction. In this case, it's all right. Now I'm going to assess the Rumber test, in which I'm going to be assessing for his stability with his closed eyes. Can you close your eyes, please? Extend your arms and then lift your right foot. And then his equilibrium is okay. I'm going to evaluate the glossopharyngeal reflex, which is in which I'm going to use a blade to press his tongue and touch the pharyngeal area to provoke nauseatic or vomiting effect on the patient. You open your mouth
And then
Cranial nerve number 10, which is the vagal nerve, will be assessed by stimulating the carotid sinus so that the pulse, the rate of pulse, or the pulse will be lower than normal. Evaluate cranial nerve number 11, in which I'm going to ask Armando to raise both of his shoulders, and I'm going to be evaluating or assessing for symmetry of both of them. In this case, both of them are symmetrical movements. Now I'm going to evaluate cranial nerve number 12, in which I'm going to ask Armando to take his tongue out to see the tongue movements and strength. You take your tongue out, move it to up, down, to your right and to your left. Now, since this is the last part of the physical assessment, I will just have to ask the patient if he have any question regarding the assessment or any other question that he may have. Do you have any questions on this
no,
side?
that's okay.
No? Thank you very much.